Angelique Wells. I'm a nursing student here at the University of South Alabama, and I'm going to be performing my site demonstrations on my patient here. So the first site we're going to do is the deltoid area. So we're going to look at the top of the shoulder bone, and this is the acromion process, and we're going to go from the midline of the arm, and that is the midline of the deltoid muscle, and the deltoid muscle connects right here at the humerus bone, which is the bone of the upper arm. So we're going to go 3 fingers down from the acromion process and 3 fingers up from the midline of the arm. So we're going to form this V, and that's right here in this area is where we would give the deltoid injection. So now we're going to do the dorsolateral aspect of the arm. So we are going to go 3 fingers down from the midline of the arm and 3 fingers up from the iliocrinial process, which is the elbow. So we're going to go 3 fingers up from the elbow, 3 fingers up from the midline. My patient, could you relax your arm, please? Okay, so the dorsolateral is more so towards the back of the arm. So here, so it would be this rectangle right here in the back of the arm is where we would inject the dorsolateral aspect of the arm right here. So now we're going to do the forearm. So if you want to come over here. Okay, so the forearm, we're going to go 4 fingers from the antecubital fossa, which is the bend of the elbow, and then 4 fingers up from the wrist, so here and here. And so the area would be in this rectangle here, and we would have to avoid veins when giving this injection. So my patient, could you lay down? So now we're going to do the abdomen. So the abdomen, we are going to go 2 inches from the umbilicus area. We're not going to go above the costal margin, and we're not going to go below the pubic or the groin area. We're not going to go past the anterior superior iliac spine. And the same thing on this side, and this will be the lateral side. Like this. Okay, so 2 inches from the umbilicus area. Not past the costal margin, not below the pubic or the groin area, not past the anterior or superior iliac spine, is just right here. Same thing on this side, which would be the lateral side. So we would form this big U. So the injection sites would be here, 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 and here. So that's the abdomen area. So my patient, can you turn? So now we are going to do the ventrogluteal area. All right, so if you want to come over here so you can see on top. So we are going to first find the greater trochanter, which is the right here on the femur. So we are going to locate this by having our patient move the arm, and you can feel it right here. Okay, so you can come over this way. Okay, so you're going to want to place your hand or your heel right here, the heel of your hand right here on that greater trochanter, and then you're going to want to have your thumb facing towards the anterior, well, not anterior, abdomen area or the umbilicus area. So have your thumb facing towards there. Then you're going to have your index finger facing towards the anterior superior iliac spine, which is here, and you're going to want to have your middle finger facing towards the iliac crest. So you would administer the injection right here in this area. So this would be the ventrogluteal area right here, and you would want to avoid bone. So you would want to make sure that you're not hitting bone, and we're not. That is the muscle. So that is the ventrogluteal. So now we're going to do the vastus lateralis. And first we're going to locate the greater trochanter, and we're going to locate this by having our patient move the arm, their leg. So it's right here. So I'm going to go hand spread from the knee, hand spread from the greater trochanter, and we're not going to go past the midline on the top of the this muscle here and on the top of the leg, and we're not going to go past the midline or the side of the leg, which is right here. So it is going to be this big rectangle here, this big muscle, and that is the vastus lateralis. So this concludes my site injection performance. Thank you.